Hello everyone, I am Dr. Swathi. Today I am going to talk about two IVF related procedure, that is egg freezing and embryo freezing. Historically, first baby with frozen embryo was born in 1984 and the first baby with frozen egg was born in 1987. So these both are time tested procedure, and I will be talking about three aspects. What are you required to do if you want to go for oocyte and embryo freezing, then what are the indications for the procedure, and then finally I will discuss about the success rate of each procedure. So coming to the first part, if you are considering an oocyte, that is egg or embryo freezing, first thing a doctor will ask you to check for your ovarian reserve, which is largely determined by your age, then number of antral follicle in the ovaries and anti-Mullerian hormone level. Then we check for the general body fitness for the aspiration procedure, where we check hemoglobin, liver function, kidney function, sugar and screening for viral infections. After that, gonadotropin hormone injections are started from the second day of period. Usually injections are given for around 7 to 11 days. After that, egg retrieval procedure is planned. The procedure is usually a simple one which takes just 10 to 20 minutes, and after procedure we check the maturity and the quality of the egg. A mature egg we label as M2, and if the egg is mature M2 and you are for a oocyte freezing, egg is frozen same day. If you are for the embryo freezing, then we inseminate the aspirated egg with husband's semen, and after 3 or 5 days when embryo develops, it is frozen. Now we will discuss about oocyte freezing indications first. Historically, oocyte freezing was offered for the ladies who were having some cancer and for which they had to undergo surgery or chemotherapy, radiation therapy. All these treatment can damage the ovaries permanently. So the option here is to freeze the eggs before you start the treatment, and later on when the cancer treatment is complete, you can go for ICSI and transfer of those embryos. Then second indication for oocyte freezing is for the couple who require a genetic testing of the embryo. Usually for genetic testing we need more embryos. So more embryo means you need more egg. Usually more than 10 egg we require to perform a genetic testing. But there are some ladies who usually get just 4 to 6 egg after one aspiration attempt. So here also we have option of freezing those 4 to 6 eggs, going for one more cycle of aspiration, and later when we get enough number of eggs, go for ICSI, make the embryo, do the genetic testing on the embryo and transfer the normal ones. Similarly, oocyte freezing is also offered for the couple who are actually for IVF or ICSI, but on the day of aspiration we are not getting any semen sample, like when husband is not there in the town, or there are no sperms in the given semen sample, or in azoospermic male when we don't get any sperm after TC or micro TC. So in such situation, if the couple doesn't want to use any donor sperm, the only option is to freeze those eggs and treat the husband for the issues, and later on when husband can give a semen sample or when we can retrieve the sperm, that time only perform ICSI with those frozen eggs. Similarly, there are ladies who wish to electively delay childbearing, like who want to pursue higher education or for some career goals or for some personal reason. If somebody wants to delay pregnancy, then oocyte freezing is the option. We all would have heard that in 2014 itself, Apple and Facebook offered their female employees to pay for their elective oocyte freezing. So it's no more an experimental treatment. Now coming to the second part, which is embryo freezing. Usually when we do an IVF procedure, when we retrieve the eggs and embryos are made, usually 1 or 2 embryos are transferred. Most of the time, in more than 50% of cases, we get extra embryos. If we try to transfer all embryos, that will increase the risk of multiple pregnancy. So the safer option in such cases is transfer just 1 or 2 embryos only, and the balance embryo should be frozen. Similarly, again there are couple who require genetic testing of the embryo, but for a proper detailed genetic testing it needs time, and we cannot keep human embryo for more than 3 or 5 days. So again here the option is to freeze the embryo, let the genetic testing complete, and after the results are ready we can select the normal embryo and transfer it. Similarly, there are conditions where we cannot do fresh transfer, like sometimes after stimulation, when ovaries are hyperstimulated, fresh transfer should not be done. Similarly, when after treatment, when estrogen hormone, progesterone hormones are very high or uterus lining is very thin, then also fresh transfer should be avoided. Similarly, there are certain situations when uterus has some abnormality where fresh transfer should not be done, like ladies who have fibroid, adenomyosis, persistent polyp in the endometrial cavity or a hydrosalpinx. These things should be corrected before the transfer is done. Similarly, ladies who are obese or overweight, they also are advised to lose weight before the actual transfer is done. So once we retrieve mature oocyte and embryos develop, we freeze both by a process of freezing which is called vitrification. There are two ways of freezing. One is slow freezing, which is not very successful method. Other is vitrification, which we follow here at Craft. In vitrification, the oocyte and embryo, they are ultra rapidly cooled to a temperature to minus 190 degree and stored at same temperature in liquid nitrogen tank. Once we have frozen the egg and embryos, it can be kept frozen for few months till up to even 5 to 10 years. There is no harmful effect of prolonged freezing on egg quality or embryo quality. And when we wish to do the transfer, then frozen egg and embryos are again rewarmed by a process which is called thawing. And here at Craft, when we do thawing of frozen oocytes, we get almost 90 to 95% survival, and for embryos we get almost 95 to 98% survival, which is a very good survival rate. So after survival, if we have frozen the oocyte, the only drawback is frozen oocyte cannot be used for simple IVF procedure. We need to do ICSI procedure for the frozen oocyte to get the embryos. So once we get the frozen embryo or embryos which are formed after using the frozen oocytes, the next procedure is very simple. We just have to give some hormone tablets to women to make their endometrium lining ready for the embryo transfer, and then transfer procedure is done. So now coming to the success rate of the procedure, as I told you, embryo and egg can be frozen for any duration, and as such there is no difference in implantation rate or pregnancy rate or take home baby rate with a healthy frozen egg versus fresh egg, or fresh embryo versus frozen embryo. But still, even if you freeze egg and embryo, that doesn't always guarantee a healthy pregnancy. When we freeze the oocyte, for one frozen oocyte we expect around 5 to 15% pregnancy chance, and for one frozen embryo we expect around 20 to 30% pregnancy chance. So that means if you have more number of egg and embryo, you definitely have a higher chance of pregnancy. The chance of pregnancy, it is largely determined by the number of egg and embryo plus the age of the woman at the time of egg retrieval procedure. The younger the age, we get better quality embryos and eggs. Usually what happens for every woman, they are all born with the fixed number of oocytes, and as the age increases, the egg come down in number and quality both. After 35 years, there is more chance of having a genetic abnormality in the oocyte, which can result in a genetically abnormal embryo, finally leading to infertility, abortion, or genetically abnormal baby like Down syndrome. So the age of the woman at the time of egg retrieval procedure and the number of retrieved egg are very important factors. Usually to ensure one healthy pregnancy, we should collect between 10 to 15 egg for the freezing purpose. And the chance of pregnancy is directly dependent on your age. Suppose you have collected around 9 to 12 egg and you are in your 20s, your chance of having a baby is almost 60 to 80%. But same number if you have collected when you are in 30s, your chance of pregnancy will be around 40%. Same number if you have collected when you are already reaching 40 years, your chance of pregnancy will be just 10 to 20%. So that's the important thing. The best age to go for oocyte or embryo freezing will be in 20s or early 30s. So to sum up this discussion, if you are planning for a oocyte or embryo freezing, I would recommend you to meet one IVF specialist who will check your ovarian reserve, and they will analyze husband's semen parameter also, and depending upon your whole clinical scenario, your age and your expectation, they will suggest you whether to go for egg freezing or embryo freezing. So whatever your clinical situation is, if you want to delay pregnancy for your career, or you are already, somebody has told you that you have very poor ovarian reserve and you should go for donor oocyte, or you are having a genetic abnormality running in family and you want to get treated for that, best thing will be consult your specialist as soon as possible, and there is always a hope for everybody.
Craft Fertility Center, caring couples.